We're muscle movement therapy, and we have a different approach to get better results. And at this time, we're going to talk about, we've already covered phase one. We're going to talk a little bit more about phase two. Phase two is also called the motor dysfunction phase or the motor control phase. At this time, what we're looking at is getting into an assessment that looks at the particular reason why somebody may have got hurt. This may be a squat, maybe a deadlift, maybe bending down. What we want to do is make sure we're getting in to see if we can find out what motor control we can have an effect on. So this is usually a phase of care where I kind of turn into a coach and our team kind of turns into a coach. It isn't so much reliant on us, it's on us developing a team and getting the appropriate exercises, stretches, and even like the right type of things that we can get for people to be able to help manage this on their own. So this motor control phase is an exciting one where the person has to take a little bit more advocacy on themselves. There is always like safety nets we do kind of keep evaluating. I'll usually give 1 to 2 exercises to see if we're getting the control down, but we also will always go back to our evaluation to make sure that we can go through. At the end of our motor control phase, before we get into our support phase, it is typically for every injury, we have some sort of prognostic factors where this will be for low back pain, for example, is going to be endurance testing. We have research controls that can tell us what their risk of further injury is or future injuries are. So we can have our core endurance testing, squat testing, single leg stance. We have parameters for age and gender for those so that we can get the best results so people can have continued results as well.